We've Got Your Back on ABC 27 is presented by Penn State Hershey Spine Center.
Welcome back. Now joining us is Dr. Mark Knob, an orthopedic spine surgeon at Penn State Hershey Spine Center. Now, every year between 10 to 12,000 people have spinal cord injuries nationwide. Spinal cord injuries can be very serious. That's right, Dr. Knob?
Absolutely. There's a wide range of types of spinal cord injuries ranging from the most severe, which we call complete, where there really isn't any signal getting down through the spinal cord. So those people have total paralysis. They don't have any sensation below the level of their injury. And on the other end of the spectrum, there are incomplete injuries. Those are injuries where there's still some neurologic signals, some signals getting past the level of the injury. Those people have partial paralysis or weakness and some sensory disturbances.
Now, most people know about the football player, Kevin Everett. What was his situation?
He had a very bad fracture, almost a dislocation in his cervical spine, and he had an incomplete spinal cord injury. Those types of injuries have a much better prognosis than complete injuries. His incomplete injury allowed the surgeons to rapidly decompress and realign his spinal cord, or decompress the spinal cord and his spinal canal, and he's had miraculous recovery, which is not unheard of with those types of injuries.
Well, now we have a story about a complete spinal cord injury. A Carlisle teenager must now rely on a wheelchair to get around. Last year, a car accident crippled her body, but not her attitude.
You hear about other people being in accidents and ending up in wheelchairs and, you know, dying in a car accident. You hear about it, but it never happens to you or somebody close to you.
But this time, the story was about 19-year-old Moriana Catello.
It was May 16th. And me and my boyfriend Brian were driving.
I was just going too fast, it was wet, and just the car started spinning and just the back went straight into the guardrail.
I didn't have my seatbelt on. My seat back broke and I slid off the seat and went like halfway out the back windshield.
The next thing she remembers is a hospital room and her boyfriend Brian DePasquale by her side.
The doctors told me a bunch of times that I wasn't going to be able to walk, but somehow it didn't register.
Moriana is paralyzed from the waist down. Her dancing days are now a memory, at least for now.
It was hard to see her like that and knowing like I was the driver. I walked away with minor injuries. She obviously had a serious injury. If I could have took her place in a minute, I would have.
She had one of the worst spine injuries that I'd ever seen in terms of the bony injury.
Dr. Mark Knob operated on Moriana's spine. It was his job to put it back in place.
We realigned her spine basically with the implants or with the screws that we put in there, and then held it in place with the rods. And then we put some bone graft material down there, which facilitates the fusion over time.
1 month after this complicated surgery and still a hospital patient, Moriana did something that caught many by surprise. She graduated from Camp Hill High School.
My sister had to push me because I was weak and I was, I didn't really know how to do things. I was still learning how to do everything I used to do in a wheelchair now.
Since graduation, Moriana has learned a lot about getting around in a wheelchair.
I just wanted to talk about that a little bit.
Thanks to the Spinal Cord Injury Support Group, it meets once a month at Penn State Hershey Medical Center.
Moriana, anything new going on with you?
I went to the Spice Girls concert yesterday.
Oh, wow.
It's a time to listen, learn, and laugh. Family, friends, and a positive attitude keep Moriana moving ahead.
Well, at first it feels like it's kind of over, but as you learn more things that you can do and like you get better at, just doing everything, you just realize that you can still do everything you used to do, just different.
I'm proud of her. She's come far and she's still going, so yeah, I'm real proud of her.
And Moriana loves to travel, and the wheelchair is not stopping her. For New Year's Eve, she visited family in South America. And Moriana told me, and as her surgeon, I'm sure you know, she sees the wheelchair as a way to get around, not an obstacle.
People of Moriana's age, young people who have these types of injuries, sometimes go into a shell, become very depressed and desolate about their condition. Moriana really did the opposite. She looked at it as some sort of an opportunity. She's really not missed a beat. She's really gone on with her life as best she could.
She's doing a great job. Now, injuries like Moriana's are very complex and thankfully not all that common. Dr. Knob, what are some of the more common surgical procedures performed on patients with spine problems?
Probably the most common things that we operate on are herniated discs, either in the neck or the low back. When the discs cause arm pain or leg pain, the piece of disc that's out of place can be removed and it alleviates the patient's extremity symptoms.
And we have a viewer question, and this is what it is. It says, I've had 4 back surgeries on my lower back. I'm currently seeing a pain management doctor for daily medication, including morphine. Are there any new surgeries or procedures available that could help me?
This is one of the most challenging situations that we face. People who've had a number of procedures are less likely to get improvement from any further surgery. Their chances of getting better just go down with every surgery that they have. Recommendations for someone like this would probably to be as active as they can be, try to maintain activities like exercising, walking, stuff like that. Sometimes therapy, sometimes injections can be helpful for them, but unfortunately people like this many times we can't cure them.
One last question. I guess you could say this is the million-dollar question. What can all of our viewers do to prevent back problems? Is there an answer?
Back pain is 90% of people suffer from it throughout their lives. There's no way to prevent it. There are some things that we can do to improve our general back health. Quitting smoking if you smoke, don't use tobacco products if you don't do so, maintaining your weight, maintaining some sort of aerobic activities, and this can be something as simple as walking, exercises to strengthen your core muscles, your abdominal muscles, the extensor muscles of your spine can be helpful as well, but there really is no one answer for everybody.
Okay. Now, why don't we check in with Chuck Rhodes? He is standing by in the ABC 27 call center with Dr. Hills. Chuck?
Deborah, we continue to see the phone just ringing, nonstop since we put the numbers up on the screen. They will remain on the screen. And again, we can't get to every call. The doctors will follow up later as best they can when your calls after we go off the air there. Dr. Hills, a lot of different calls coming in here. We have one we're going to put on the screen there. This deals with herniated disc. You hear that an awful lot. Tell us about this case and what he recommend for this person.
Well, this is an interesting story because the patients had physical therapy, 1 cortisone injection, and they haven't received any relief from it. Time to stop and look over the whole circumstance. I wouldn't encourage them to continue the therapies. I'd encourage them to have their doctor take another full look at this story and find out if there are other issues besides the pain that they're having. If that pain is radiating into the arm, that's serious.
Follow it up with another exam, and don't rely on Uncle Ed to tell you how he handled it.
That's right, that's right. Go back to your doctor, look at this whole thing. It might need a new set of imaging studies. Definitely communicate with the doctor, and the therapist should communicate and find out if they're doing something. Maybe it's the therapies that are aggravating the circumstance.
Just by nature, when you talk about the back, it can't be that simple. So, Deborah, the phones are ringing and a lot of questions coming in there. And again, we'll follow up as best we can later.
Okay, thanks, Chuck, and we will talk to you a little bit later. And Dr. Knob, we want to thank you for joining us.
Thanks for having me.
Okay, and with the technological advances in today's medicine, surgery does not always mean a long recovery time. Coming up next, you will meet a man who spent 1 day in the hospital and was back on his feet the very next day.